What we've accomplished is clear lines of responsibility, a clear definition of local expectations, improved tracking, data-driven accountability, staff training and support, increased utilization of CPS, and mobilization of community partners. Let's go through, and district-wide decrease in absenteeism. Let's go through those one at a time. When everyone's responsible, no one is responsible. So under the previous situation, everyone who worked for a school district was a mandated reporter, and they were responsible for filing educational neglect reports whenever someone missed a lot of school. The problem was, when everyone was responsible, no one was responsible. Solution? Clear lines of responsibility. So Mount Vernon has a truancy liaison, one person in every school whose job it is to track data, encourage attendance, and file CPS reports. But dealing with truancy in a school is not a one-person job. You need teachers to help, you need guidance counselors to help, you need teachers to collect notes and office personnel to enter things into the database and help file reports. So, principals have the ultimate responsibility for managing the process in their schools. What makes this work is that the superintendent has told every principal that part of your job performance evaluation will be the extent to which you follow this policy and address chronic truancy and absenteeism in your school. In terms of clear definitions of local expectations, the problem was how many absences are too many? What constitutes educational neglect? No one has defined that in New York State. It's up for each individual or community to make their own decisions. And when they made no decisions, nothing happened. What we did was we made a safety net. We were mandating that people report to Child Protective Services any child who has 20 or more unexcused absences in a single year. The reason we chose 20 is because that gave us a pool of around 1,000 people, and that was more than enough for us to begin working with. In Oregon, the cutoff, the definition of chronic truancy is 10. And as we've gotten better and as we've whittled down the numbers, we expect to move the bar, the trigger, from 20 to 15 to 10 as we intervene earlier and earlier in the process. Protocols for early intervention. When we file a CPS report, CPS says, so what have you done to address this problem on your own? Turns out that we now have policies for what should be done in 5 days, what should be done at 10 days. By 5 days, a letter should go out to the parents. By 10 days, they should be doing an in-depth investigation as to what's going on with this child. And if they can see that there is a problem, potential educational neglect, at 5 or 10 days, they can go ahead and do it. But by 20 days, if the problem isn't solved, they need to bring in the cavalry to help. Supplemental reporting form. We worked with the County Department of Social Services and the County Attorney's Office to come up with a form that basically teaches school personnel what records do you need to look at, what questions do you need to be able to answer, and then have that in front of them when they phone in the CPS report and then fax it to the local CPS office. So instead of just knowing I have a name and 21 days of absence, they have a report that documents the involvements and the different kinds of impacts it's having on the child. Monthly monitoring and data review. That's been phenomenally important. People do what you measure. The fact that we are now measuring the extent to which each school follows the policy and reduces absenteeism is having a tremendous effect. In terms of improved tracking, when we started, there were 1,005 kids who had 20 or more unexcused absences in Mount Vernon. Next year, there were 983. By the first year of implementation, we got it down to 257 and 262. Now, I would love to say that we cut truancy by 75%, but we didn't. What we did was we improved tracking because there were lots of kids who were being counted as unexcused when they had left the district, when they were in jail, when they were in the hospital, when they were in another educational program, or when they had been sick, but the parents didn't know they needed to send in a note, or the kids didn't give the teacher the note, or the teacher didn't pass on the note, or the office didn't properly enter the note into the attendance database. What we've done is we focused on getting real data. And now instead of having 1,000 kids that we need to somehow target intensive services to, we have 257 who are high risk, and there we can focus our efforts much more productively. In terms of data-driven accountability, truancy liaisons meet monthly. What we do is we put a list sorted by school of every child with 20 plus absences, which ones have been reported and which ones have been ignored. and we pass that out around the group where all the different schools are represented. And if it says on there that a child has 36 absences and they haven't been reported, we ask them to say why. And there needs to be a very clear answer in front of the whole group. They're basically answering in front of their peers, the Director of Pupil Support Services in God, why they have or have not responded to each one of those child's needs. Liaisons and principals begin to compete for the best results. I think we have 4 schools now that have 0 students with over 20 plus unexcused absences. Schools must account for every student. Now, when we started this process in nearby Yonkers, we did a sample of several hundred, I think, chronic truants. And we assumed that probably CPS already knew them. Turned out the CPS had never heard of most of those kids. And the most extreme case, there was a little boy repeating first grade for the 3rd time. And in his 3 years of trying to pass first grade, he had 158 unexcused absences, and no one had ever noticed him. Because he was just that little kid that nobody knows, that empty seat over in the corner. And he got lost in the shuffle. And his entire life trajectory is changing because he got lost in the shuffle. Now that there is this list, you can't do that. In 10 seconds, you can go through and say, this kid has 36. He has more than anyone else in the district. What is the problem and what is the answer? In terms of staff training and support, the monthly meetings, we have all of the school liaisons present. We have outside agencies present. We've got the Department of Social Services, and we've got the Director of Pupil Support Services for the school district. So we can answer questions, resolve problems, and help. If they're not sure what to do, we can make the decision or recommendations on the spot. The other thing is the truancy liaison started saying, okay, now we've got good data, but it takes you too long to give it to me. I want to have direct access to the data. So we've trained the truancy liaisons so that they can see how many kids in their school have 5 days, so they can make sure letters have gone out, how many have had 10 days, so they can start scrambling to put those at the front of their list, and how many have 20 days and that they need to have reported. And it turned out that many teachers or many school personnel had not had refresher training in the legal requirements of their being a mandated reporter. So that we brought in the CPS and the county attorney's office to teach staff, to remind staff of what their legal responsibilities were as mandated reporters for Child Protective Services and to answer any questions that they had. Now, increased utilization of CPS. What that is it's like a powerful tool that was lying around, rusty and unused. So that before we started, there were 65, 72, 57. First year of implementation, 227. A 400% increase in CPS reports, which means that we're mobilizing caseworkers who can go into the home, can see what the problems are, and access other resources. In terms of community partners, we have student advocacy involved. What they are is they are advocates for the families, because sometimes truancy is not the fault of the child or the family. Sometimes the school's involved. Sometimes the answer is to move them to a closer school, a school that's away from the bully, or to give them more special ed services. And student advocacy is at the table every time to keep us honest and make sure we're looking at all the possible causes. We have Family Services of Westchester. They have the Big Brothers Big Sisters mentoring program. They have gang prevention programs. They have mental health services. Student Assistance brings drug and alcohol services to the table. Family Ties does family counseling. Community networks, that's a process we have where families can, in a non-judgmental setting, come to Family Ties and say, bring everybody who can help this family together in one room. It might be your aunt, it might be a coach, it might be the social worker from mental health. Get everybody there and figure out how to help this family. And so instead of saying, you're a bad parent, you need to do something different, this is saying life is really hard for you, let's get everybody together and figure out how to make your life easier. And it's not just paid staff too, it's all the informal networks that often are the ones that help families stay together. Mount Vernon Communities That Care is a citywide coalition that includes almost every major service provider in the city. What we do is we go to them and say, you want to help high-risk kids? Then focus on chronic truants. work with the schools with get the lists from the different schools, or ask to see a report card, or give preference on your waiting list to kids who are chronically truant, because that's a very clear and powerful indicator that the child is at high risk. And faith communities. We had a church here, Greater Centennial, that had, before school started, a community school day. They talked about the importance of going to school, and they gave out school supplies, and they talked about how this community needs people to understand the importance of education, and they had over 500 families attend. That was a powerful thing that the faith communities have brought to the table. Now, this is where the rubber hits the road. This is the real bottom line. We're going to look at how the district has reduced absenteeism. And notice I've shifted the definitions. Instead of talking about chronic truancy, I'm talking about all kinds of absenteeism. It's being sick, any sort of thing like that. Because you might, if I just said chronic truancy, you might think, well, they're playing with the definitions, they're playing with the numbers. This is the total number of kids reported to the state as present in a day, on an average day, compared to the average enrollment reported to the state. Now, elementary school, that's really a key area, because you need to get kids to attend more regularly in elementary school, because if you don't learn to read by grade 3, it's hard to ever catch up. And the further and further along you go, the more and more behind you fall, the more expensive remediation you need, and the more you tend to be developing other protective behaviors that interfere with continuing with school. So elementary, if we could work anywhere, that's the most effective place to be. Oops. When we started, on an average day, 6.22% of the elementary school students were absent. The next year, dropped to 5.56, 5.43. That's a 12.7% reduction from 6.22 down to 5.43 in a single year in elementary school. That's phenomenal. Now, middle school. Middle school is where the kid's life trajectory begins to change really dramatically. Every sort of risky behavior, violence, sex, drug use, everything, the numbers go up like that in middle school. So you want to try to intervene there. When we started, 12.7% of the entire registered enrollment in the middle schools was absent on an average day. Next year was 8.88, 8.02, 37% reduction in absenteeism for all causes. We didn't get rid of flu, we didn't get rid of broken arms, we didn't get rid of pink eye. What we got rid of was the voluntary chronic truancy that's some of the most dangerous indicators. 37% in 2 years without a penny of additional grant funding. Now, high school, there's two problems. One is that the mandatory education laws only apply until you're 16. So many high school students are not legally required to attend school, and so CPS can't use the educational neglect laws with them. They've just had more time to develop problems, negative associations and all the rest. When we started, high school, on average, over 20% of the entire high school enrollment was not present on an average day. Dropped to 16.6, down to 16.36, a 19.5% reduction in absenteeism for all costs, for all reasons in high school. Now, if we add those all together and weight them for the number of students, it started at 1109, went to 9.15, dropped to 8.89, a 19.8% reduction in total absenteeism for the entire district within 2 years without a bit of grant funding. You'll also notice that each of those levels got better in each of the 2 years. Most of it happened when we first started, but we've continued to make further improvements and further progress. Thank you.